focus on the relationship. Focus on building and strengthening that relationship so that they know that you care about them, that you're there wanting to help them and support them. At this precise moment, 1 in 4 of us here in this country are experiencing mental illness. Half of us at some point in our lives. So this is not like a really rare thing. It's very common. And so it's important that we talk about not only how to help the person, but how to help your family and help your children. Self-care is child-care, meaning it's helping your kids. You're being a better parent by taking care of yourself too.
An exploration of trauma, transformation, and triumph. Your healing starts here. And we are back with another episode of Through the Trauma Podcast. I am Amber, your host, and today I have with me Miss Michelle Sherman. And I was just talking to Michelle before we jumped on here. She has quite an extensive background in mental health. She is a therapist and she's worked with mental health, all different kinds. She also has some pretty good qualifications under her belt, and I'll let her kind of tell us a little bit about what she does and what she's affiliated with. But I am really excited about this conversation, Michelle, because I think it's a much, much needed conversation. Thank you for being here with us today.
Thank you for the invitation. I'm really happy to be here and have a good conversation with you, Amber. Thank you.
So why don't you tell my audience just a little bit? I know I gave a brief introduction, but just kind of the things that you've been involved with over the years.
I'm a licensed clinical psychologist. I've been that for about 30 years. I've worked about half of that in the VA, Veterans Affairs System. Been a professor and faculty in a couple of medical schools, University of Oklahoma, University of Minnesota. And so I've worked in a number of different settings, doctor's offices, outpatient clinics, VA hospital clinics, private practice, etc. Throughout all of it, however, my real area of focus has been supporting families in which a loved one has a mental illness or PTSD. So it's kind of been my passion through what I've done. I really have also had lovely opportunities to do a fair bit of research, fair bit of writing. I'm the editor of a journal, a couple of family psychology research and practice. So I've had the pleasure of doing a lot of different things. But throughout all of it, I've certainly worked with a lot of trauma survivors. It even frankly dates back to college. I went back when I was in at the University of Notre Dame. I volunteered as a support person to go into the hospital after someone had experienced sexual trauma. And actually I helped create the first ever support group on campus for sexual trauma survivors at Notre Dame. So my passion for trauma and supporting people goes way back before I even had credentials to do so as a young person, as a volunteer.
So it's kind of innately inside of you.
I've been doing it a long time. And I'm currently in Minnesota, I should say. I'm in private practice and do a fair bit of writing and consulting and do individual and couples psychotherapy.
Wow. Okay. So what's something that you've seen most memorable over the years?
I've really been struck, I guess I would say, as an overarching statement by the resilience of the human spirit. I've talked to people who've experienced multiple traumas over very long periods of time, during formative times, during military deployments, at college when you're supposed to be having fun and carefree. In lots of different settings and capacities, and childhood homes where one would hope one would be safe and protected in the context of serious mental illness, infidelity, domestic violence, etc. And so through all of these people, and it's, let's face it, according to the Diagnostic and Statistical Manual, the kind of quote unquote Bible of psychiatry, according to the current definition of trauma, such as exposure to or experiencing of a death and near-death experience, or having a loved one experience that, and or, of course, sexual trauma or abuse. Most of us at some point experience a trauma. So that is actually pretty high. Fortunately, most of us do not develop PTSD or long-term difficulties. And so I guess my overarching statement would be people are pretty darn resilient. And it's fortunate that most people don't go on to develop long-term, lifelong difficulties. Some do, obviously, but there's a lot of innate resilience and a lot of natural healing that happens in the context of community, family, spirituality for some people, individual resilience and support.
That's a great answer, because I truly believe in the power of the human spirit and the resilience. And I think that some of that comes with mindset. I mean, I'm not a specialist. I talk to a lot of specialists, but I think there's a lot to do with mindset and there's a lot to do with choice. We get the power to choose, but I think some people, maybe they don't have the tools. And I think this is where people like you yourself comes in, where you can provide people the tools and things to heal and give them hope and help them see light at the end of the tunnel. Because I know mental health it's on the rise. The statistics say that, I don't know them exactly, but it's on the rise in our country. And we see it in our youth, and we see it in the crime and the violence and just the things that we see taking place in the world. And I, I think mental health has a lot to do with that. I wish we talked about it a little bit more. I wish we had a little bit more tools for people and resources, but that's why we're here doing what we do.
Yeah. And the good news is, still trying to decrease stigma and decrease sometimes public misconceptions. And most people with mental illness are not violent. At times they're portrayed that way, perhaps in the media or things, but oftentimes they're actually more afraid and reclusive. Now, if you put substance use or perhaps active psychosis in there, there can be increased risk. But most people are not violent. And yes, the ability for people to heal in community by themselves is great. Part of the real challenge, of course, with some of the psychotherapies that are around is that there are 3 or 4 that have been around for several decades and that work really well. They're very effective. However, there are considerable barriers to access. So finding people who are trained in the evidence-based psychotherapies. I'm kind of a researcher, and so I like to practice and teach and do what we know research shows helps. And furthermore, trauma therapy can be very hard. And so the dropout rates for some of these therapies can be considerable, as much as maybe past 50%. And so if we get a chance today, I'd love to briefly mention a relatively newer psychotherapy for trauma that has a lot of very promising data. And I use it myself and with my clients and find it pretty helpful. So if you'd like me to, I'd be happy to share about that. But access and staying with trauma therapies are significant barriers in our field.
I do want you to talk about that, but I have a question here. I understand what you're saying, that a lot of people are not violent, but do you think that some of the violence and the things that we're seeing in the world, like the rise of these things in the world, do you think that can be a result of mental health, or how much do you think that mental health plays a part in people doing these kinds of things?
Certainly, if we look at the news or the media, people engaging in perhaps school violence or community violence or things like that, researchers are absolutely trying to get a picture of what's going on with some of these people. And it's not my area of expertise, frankly, kind of community or school shootings or things of that nature. But certainly when you look at the kind of prototypes for some of those people, you do see some mental illness that may be part of their experience. However, I get really nervous if we talk about, well, the mental illness was the cause. Who knows? We still are trying to understand what actually causes people to make those choices. But the most important message to me, in part to decrease stigma and in part to be sure we're conveying accurate information, is that most people are not violent. Again, with the subsets of certainly drug abuse, alcohol abuse, psychosis, they're actively hearing voices and things like that. There certainly can be a subset that we do know are increased risk for violence. Those disorders, well, sort of the schizophrenia sort of disorders are relatively low prevalence. What do we know is much more prevalent are things like major depression, anxiety, things like that. And most of those people are not demonstrating violence. So I think we just want to be cautious when we're talking about it.
So mental health, in your definition, encompasses everything from people that would be diagnosed, like you mentioned, like the schizophrenia or the bipolar or, those types of things. But then there's also, you would define mental health as depression or maybe having gone through a trauma. Can you make that clear for my audience?
Yeah, you bet. So when we're talking about mental illnesses, they really do range on a continuum. And there are, I believe, actually over 300 different kinds of mental illnesses in what we call this Bible, this list of mental illnesses that is pretty commonly accepted. Even so, yes, there are these different clumps of mood disorders like depression, bipolar disorder, anxiety disorders, people who are overly anxious, people who have phobias, social anxiety, etc. substance use disorders, lots of different pockets. Okay. But then within each of them, let's just say depression for a second. There are some that are severe and perhaps very disabling, such as when someone has major depressive disorder, severe, in which they are not able to get out of bed, they cannot work and things like that. That is really very disabling. Although certainly some of those people can absolutely get treatment and recover and do better, but it can be very severe. Or it can be people are going around and in their life and generally doing pretty well, and they have a stressor and they have some sort of kind of adjustment sort of disorder in terms of difficulty dealing with it. So I want to differentiate the experience of, I feel sad, I feel anxious. Those are human, from a disorder in which you have to have not only a certain number of symptoms, but it has to cause distress, it's upsetting for you, and impairment. It's interfering with your ability to do everyday life. So, and these things should be only made by a professional. It's not something you just diagnose yourself, but everyone, certainly myself included, we have mental health, we have physical health, we have emotional health. This is part of who we are. And I'm talking, I think, a little bit more about people who have mental health problems or mental illnesses, and that can cause distress.
And thank you for clarifying that, because we use these terms like trauma or like mental health or mental illness, and sometimes people are not clear. And I think it's great when we have someone with your expertise to really clarify that, because we can start to think that mental health is like it's a scary thing. But in reality, it's something that we need to talk about. We need to discuss. We need to be educated on. And that's my hope with even with this discussion that.
Absolutely, Amber. And because let's face it, the statistics say about, at this precise moment, 1 in 4 of us here in this country are experiencing mental illness. Half of us at some point in our lives. So this is not like a really rare thing. It's very common. And so it's important that we talk about not only how to help the person, but how to help their family and help their children. I'm a big proponent of these young people are often invisible, but they're confused. Like, what's going on with mom or dad? Why can't I have friends over to my house? Am I going to be like that someday? I mean, a huge experience of the children whose experiences and feelings are often kind of neglected and invisible in the mental health field.
So you work with families primarily, and are these families where maybe a parent or someone in the home is struggling with a mental illness, and then the families are having to learn how to manage that?
Yeah, I don't work with children. I only work with adults. And so I work with individuals and couples. And yes, some of them, certainly a loved one has mental illness, or we'll just make something up. This is fictional. Someone named Mary is coming in because her adult son is living with schizophrenia, or someone's coming in because their partner is dealing with major depression or whatever else. So I help either one of them or both of them in supporting and navigating this journey, because let's face it, it's different if hypothetically my husband is admitted to the hospital tonight because he has leukemia. What do people in the community normally do? They bring flowers or set up a meal train or reach out to me with texts and hugs and love. What if my husband tonight attempted to end his life by suicide or had a manic episode? How do my family and friends respond? Do they set up the meal train? So it's often really different. The stigma can be different. So I'm just so grateful, Amber, for you creating platforms for us to talk about this, because it's really important that we give people a chance to talk about it, because it can be very lonely and isolating journey. And so it's part of what I bring to people is a pretty good experience and understandings. I've been doing this for 30 years of understanding the family experience and then teaching them some research-based skills and tools to help them cope with some of the challenges along the way.
So let's assume that you had a family that is struggling with that. We'll just use your same example, the mom with the son who has schizophrenia. Are there certain actions that the family can take to encourage, like, is there things that mom could do to encourage son to stay on medication or to alter his mood in a positive way?
Absolutely right. And there are so many barriers to people seeking help, lots of reasons within a person, within the community, from I'm not sick, I don't need help. There's actually a book written by Dr. Amador by that name, because about half of people don't think that they're sick, don't think that they're ill. So why are you telling me to go get help when really the CIA is outside my door, or I really am getting special messages from the television or whatever else? So, there's a barrier of not thinking they're sick. B, there's all the barrier of stigma. Will insurance cover it? If I call and reach out to the doctor, maybe they have a 6 to 12 month waiting list. Might I lose my job? How am I going to get time off to go to appointments? There's no one in my town, no psychiatrist in my town. Who do I go to? The barriers are so many. Afraid that maybe will my wife or my children think that I'm crazy? Worry about stigma, shame. So many. Are you going to lock me up? I've had so many people say, Doc, are you going to lock me up? That fear of the system and things like that. So the barriers are great. So what do families do? Well, lots of things. And usually coming from a place of trying to be helpful. Certainly sometimes families plead and cry and beg. Sometimes they even do like an intervention and try to convince or persuade, to rationalize. Sometimes families set limits and say, you can't live here unless you go and get help. People do all sorts of different things from a good place. Because let's face it, when you see someone you love who's hurting, be it from trauma, be it from whatever else, like, I want you to get help. But from all the barriers I cited and more, there are a lot of reasons it can be hard to do so. So what can families do? I'll answer that with a brief story. Dr. Amador, a psychologist who wrote this book I mentioned, talks about he has a brother who lives with schizophrenia. He tried the techniques I just started a few minutes ago, begs, borrow, steal, persuade, convince, threaten, blah, blah, blah. And it just didn't work. So what he leaned into and what he teaches people to lean into is focus on the relationship. Focus on building and strengthening that relationship so that they know that you care about them, that you're there wanting to help them and support them. He has something called the LEAD method, which is, you listen, emphasize, gosh, it must be really scary to think that the CIA is out there, to, et cetera, et cetera. It goes on and on for ways of tools of talking to them. So trying to get away from convincing, pushing, shaming, threatening, all those things, they're probably going to distance and hurt your relationship. They'll be even less likely. So finding ways of showing up and leaning into a relationship. And in this story with Dr. Amador, his brother did choose to get treatment, but not because he thought he had a problem. He did it because he knew that his brother wanted him to. So using the relationship. Secondly, families can get away from words like, oh, you have schizophrenia, or you are bipolar, whatever else, and instead focus on the symptoms. Hey, bud, you're not sleeping. Could we maybe go to the doctor and help you get some sleep? Let's get away from diagnosis. Let's get away from labels. Now talk about, I notice this is really a struggle. Could we help get some focus on that? And third is to kind of be patient and persistent. Continue to try to plant the seed, to learn community resources such that when they aren't ready, okay, I know a really good doctor that my friend recommended, or I know this person doesn't have a very long waiting list, or this person's covered by our insurance. So be ready when the timing is coming. Those are some ideas. And then fifth and finally, have the loved ones find ways of taking good care of themselves, because that can be really hard. Waiting and wondering and wishing so badly that they would get help. But what can I do as a family member to soothe my own spirit? To realize, unless there's imminent danger, which of course is a different story, ultimately their choice. And I need to learn ways to calm my own self, my own frustration, my sadness, when they're not doing what I think they should be doing, and find ways of take care of myself, which could involve perhaps deep breathing, yoga, friends, spiritual counseling for myself as a family member, connecting with NAMI, which is the National Alliance of Mental Illness, that has free in-person and virtual support groups for people who have some of the mental illness, et cetera, et cetera. But taking good care of yourself, because it's hard when people we love don't do things that we think would be best for them.
We had mental health in my family. When this began to show up, they were in their 20s. Is that common?
It depends on the illness, but that's a very common time. Late teens, 20s, yes, it's a very common time for mental illnesses to emerge.
Why is that?
Why? I don't know why. I mean, there are a lot of changes going on developmentally during adolescence and things of that nature. And so that can be influencing as a higher risk time. I mean, what we know for all mental illnesses is there's kind of a risk that is often inherited. So, for example, this is not true. If my dad has bipolar disorder and my grandpa has bipolar disorder, then just how my genes were made, I may be at higher risk for having bipolar disorder. So you inherit this risk, and then you have some sort of stressor, some sort of life experience that might put you to the point that the illness may emerge. And if we think about people perhaps finishing high school, perhaps going to college, perhaps leaving the house. These could be times of big stress. And so that can be part of what may be contributing to it emerging. Then overall, it's actually an interesting question though, in terms of why does it actually emerge then? I don't know, but that is generally what we find. That is kind of a time that they do tend to emerge then.
Yeah, it's been something that it's on my mind a lot. I'm just curious. So I'm of the belief that we live in a very toxic world, toxic in what we're putting into our minds through what we view and what we listen to, but toxic also in what we're putting into our bodies physically, like our food and our medicine and our, the things that we're ingesting. And so it's been something that I've really thought about a lot. Like, is this something that could have come from an external factor? And then why presenting in the 20s, it is alarming. I'll tell you just very honestly, like as a mother, it's very alarming because, I have kids. And so it's like, are we constantly on high alert? Like, could this present itself in their life? And so because of that, I've always taken the stance of we're going to try to stay away from, food dyes and anything that affects the neurological makeup. That has been very challenging. I got a 10 and a 13-year-old, and it's very challenging because they go away to school and then who knows what they eat. But I'm just curious if you had any thoughts on those things.
Yeah. I mean, that is the whole reason we wrote our second book called I'm Not Alone, a teen's guide to living with a parent who has a mental illness or history of trauma, because we do know they are at higher risk. And so the elephant in the living room sometimes is not talked about. It's like, oh goodness, is this my future? And is there anything I can do about it? And so a huge part of what we talk about in that book is resilience. How can we increase your skills and being able to cope with stressors, to identify warning signs early, to know what to look for, and then who to reach out to, okay? Because we know across the board, early intervention, detecting and getting help for the illness sooner is a lot better than waiting when it's been going on for a long period of time. Sadly, there's usually a long gap between symptoms and treatment for many of the barriers I described a couple minutes ago. But the sooner and we can educate kids. And frankly, as I said, I've been doing this work for 30 years. I do think there's more public knowledge and understanding of things like depression and anxiety. Sadly, there's a lot of misinformation too, of course, but there is more information out there that kids know and talk about. And perhaps even among some people, some decreased stigma surrounding depression and anxiety. People talk about it more. So if we've got talk about it, I can recognize, all right, I'm not sleeping. I have no appetite. I just have no energy. I'm just crying. I'm isolating in my room all the time, having panic attacks, whatever else. It's like, okay, who can I talk to? So being aware of those warning signs. Certainly, if there's any thoughts of harming yourself or someone else or those sorts of things would be a red flag. But I'm talking about kind of lower level sorts of things, being aware of those. Then having the awareness that there are some things you can do. There's actually some research that looks at things like regular exercise, being thoughtful about our healthy food, getting enough sleep, avoiding social isolation, staying in contact with other people, minimizing or avoiding use of excessive alcohol or street drugs. All these things are what we call protective factors, okay? Having someone in your life that you can trust, you can count on, that you can turn to. All these things are things that can help these children. Can it guarantee they won't develop illness? No, there are no guarantees in this life, but it can actually hopefully prevent the likelihood. And then if they do develop difficulties, they understand it and they get help earlier. So there's absolutely a reason to be hopeful. That's the name of our company is Seeds of Hope, folks, because we're very believing in hope. Sadly, however, in Michelle Sherman's opinion, these young people are often invisible. Because let's say again in a family system, if my husband is, having psychosis or is excessively using drugs or things like that, I'm struggling myself to keep up the house and get the kids to the soccer games and do this and that. Who's paying attention to the kids? No one's thinking about them because everyone's thinking about my husband who's struggling or thinking about me. And so these kids often blame themselves. What did I do wrong? Even the doctors, I'll tell you, having worked with a lot of mental health professionals for years, turns out they even ask, do you have children? Much less, how are the kids doing? So my huge stance is trying to empower mental health providers to say, ask, please. And not just when someone's admitted to a psychiatric unit, but ask, are there children? How are they doing? And how can we support them? I'm very much in a prevention mode. It's hard to fund prevention. and to get monies and things for it. But these are the next people in our waiting rooms. These are the next people who are having difficulties. I have a real strong passion for seeing and supporting children.
Yeah. I would think too that that is a traumatic experience. This grieves my heart greatly, the whole thing of a child being abused in the home and they can't get away from it. So it's a consistent thing that's happening on a regular basis. That's traumatic because you really can't heal from that trauma until you start to get away from the situation. So the only thing I think a lot of people do is disassociate, and this causes a lot of issues, longer and down the line. But we don't think about mental health. I had not really even considered like some of the things that you're sharing. And that also, even though it's not abuse, but it could be neglect. There could be issues with just the child seeing their parent that way. And this is greatly traumatic because again, it's not one of those things they can just walk away from and heal from it. It's not a one-time thing. It's an ongoing childhood experience.
Yeah, so we see two extremes. We see one, no one's even asking about the kids, and that's not good. The other extreme is what's called presumptive neglect, meaning just because a parent has a mental illness, I'm going to presume that the children are being neglected or abused in some way, shape, or form. And actually, houses in which there's a mental illness, the rates of children being removed are like 8 times higher. Now, I want to be really clear. Many, many, many parents with mental illness and their co-parents are very effective parents. Just because you have mental illness doesn't mean that you cannot be an effective parent. The system just assuming that you cannot parent this child because you have mental illness is not fair and scares a lot of parents. And it's why they don't ask for help. So you're going to take my children away from me. Okay. So it's a huge issue. We have these two extremes of not asking or looking at all, or oh, there's got to be a problem, so we're going to take them out of the house, which again can be very upsetting for everyone. So we got to figure out somewhere in the middle. We got to help parents know how they can parent effectively and get supports from their natural supports, from perhaps broader community professional supports, and definitely see and find ways to support these children. Absolutely. Of course, children always deserve to be in a home that is safe and a place that is safe, and we can help parents do that more.
Well, and I've sat with people who come out of the foster care system. If the kid they're probably better off with parents that really love them. Sometimes it's not advantageous to take them out and put them into a foster system. So it's
very
like
disruptive, very disruptive.
What do we do? I guess, so this does lead me to the question of like, what can we do besides talk about it? Raise awareness about it, I'm sure is huge. But are there signs?
Support the parents and support the kids. So I'll tell you a little story. In a week and 2 days, I'm actually going on vacation to London, where they have a program called Our Time. It's been around for many years. And their whole focus is on supporting children whose parents have mental illness. There's nothing like that in the United States of America. And I'm a big supporter, a big fan of NAMI, National Alliance of Mental Illness, but they don't see this subgroup at all. Quite a number of us have been advocating for a long time. It's like, what about the kids who suffer mental illness? But it's just not a focus area. And it's difficult. So I think it is hugely important that we grow awareness of these young people and their needs and experiences and provide them resources. And that's a large part of why we wrote this book, to help adults know how to have conversations. It can be a basis for a support group at school, at church, in the community, wherever else, at the mental health clinic, the adults going, let's have something for the kids at the same time. So I think, yes, raise awareness. Yes, I think we need to educate healthcare professionals, teachers, everyone who's working with children to be looking for this and give them tools and ways to talk about it. Not in we're going to, make a report to Child Protective Services and your kid's going to be yanked out of your house. How can we help you as parents? What do you need as parents? What do these kids need in terms of other ways to get support? So we've got a long ways to go, but I think having the conversation is a great starting point.
Are there certain things that you would recommend, like someone, especially someone that has access to kids, teachers, coaches, friends even? Is there things that you would say to look for to raise red flags that, hey, we need to dig into this a little bit more?
Yeah, it's such a great question. The hard part is, and yes, I can rattle off symptoms or problems or red flags, but they can be so multi-determined. They can be caused by so many different things. So if I say, you see the kid has on the same shirt 4 days in a row, I don't want someone to jump and say, aha, there must be mental illness in the family. It could be due to their washing machine broke. It could be due to financial challenge, and it could be due to so many different things. And so I can't give you like, okay, if it's this, then you know it's this. It just is more complicated than that. But certainly seeing, falling behind in school, parents not being involved or active or engaged, changes in their appearance, changes in how they interact with others, appearing really sad, irritable, withdrawn, having a hard time paying attention. But there are lots of different things that you can look for. But we can't automatically conclude that it's due to family mental illness. It takes that relationship. It takes getting to know the young person and the family and understanding what's going on. And then helping them to see you as someone who's trying to help them, not someone who's trying to disrupt their family. Because that's the fear. And understandably, given the statistic I just told you a couple minutes ago, there's a good reason to be afraid of the healthcare system. And the longer we perpetuate and keep that fear, then families aren't going to talk about what's going on.
How do you provide a safe place for that?
It's hard because we professionals are mandated reporters, so we do have to report if we are afraid that the child may be a danger. That is a threshold that hopefully we can help the child before it gets to that point when we feel that they're in imminent danger. And so listening, talking, trying to get parents involved in different sorts of ways, and being open to listening, because oftentimes they will share things with you if you listen. And so forming that relationship, they feel comfortable to talk about what's going on. Homer, hope your mom's going to come to the choir concert next week. She can. Well, that's too bad. Why not? Well, blah, blah. So listening and being open. I was like, oh gosh, that may not be your first comment of, is she getting help or whatever else. But yeah, I'd love to talk to her sometime and learn how she's doing. If there are ways that we can support her or through our church or whatever else, through NAMI or whatever else, knowing community resources and being aware, able to connect with people where they are. Again, mental illness is not rare. So in terms of looking at some research the other day, about 1 in 3 kids have a parent who has depression or anxiety symptoms. Okay? If we talk about mental illness, 1 in 5 kids have a parent with mental illness. This is 20%. This is huge. Now, if we look at the schizophrenia and things like that, it's certainly going to be a smaller number, maybe 4 to 7%. But if we're just talking about symptoms and we're talking about all disorders, 1 in 5, that's a lot of kids. Okay, so it is essential that we find ways of talking, educating, and learning about this so we can help the entire family.
I wish there was more that we could do. Obviously, it's a topic that touches my heart greatly. And just my experience dealing with the mental health, but not even the mental health, just the medical in general. There's problems, there's issues. I just feel like I hate to see someone going into the field that is not truly passionate about it. And then I just feel like people need to be educated even more. The therapists, the doctors, the people that are handling these situations.
Yes, but the other thing I just want to add for the co-parent or the other adults, I read this the other day and I really liked it. Self-care is childcare. It's helping your kids. You're being a better parent by taking care of yourself too. Okay. I'm not talking about, 10-day cruise or something like that, but it's like taking 5 minutes to go in the bathroom, shut the door, do some stretching or take a bubble bath or something like that. Going outside, going to a yoga class, calling a friend. The more that we as co-parents or other adults who are loving criminals, we're teaching our kids and they're watching us. And it's so important that we take good care of ourselves because for some, not all, but for some mental illnesses, it can be a long-term journey. And so we talk about it being a marathon, not a sprint. And so buckling in and getting my own supports and my own strengths, my own therapy perhaps to help me through this so I can be an effective partner and be an effective parent. So we're all on this together.
That's beautiful. And I do think, like you said in the beginning, there is hope on the other side of this. And I think every person, regardless, we all have things. We all have baggage. We all have trauma. We all have struggled with mental health at some point in our life. If we're not currently struggling with it now, being, whether that be depression or anxiety or, PTSD, it can look all different ways. But I do think we all have misconceptions as well. And you've clarified a lot.
Two people, with the same exact disorder, or even like, for example, 2 people who went to Iraq, or 2 people who lost their house in a natural disaster. Even though the same age, same experience can have very different reactions. So there is no, even if you say PTSD, it can look so different across people. And so everyone's experience is absolutely unique. So it's necessary for us as healthcare providers to take the time to listen, to not assume I know what you need or what therapy or medication or things. I will just want to mention briefly the therapy I mentioned at the very beginning.
Yes, I wanted you to come back to that.
Written exposure therapy, WET, written exposure therapy. Just look it up. It's created by a couple of psychologists, the National Center for PTSD at Boston University, Doctors Denise Sloan and Brian Marks. And it's actually a 5-session psychotherapy, so it's much shorter. And the research is showing it's just as effective as some of the longer ones. People like it and finish it at much higher rates than these others. And the outcomes for depression and PTSD symptoms are just as good as the long ones. So we've got a treatment that may be provided like at your primary care doctor's office or different places like that. So there's, again, reason to be hopeful because there are new treatments being developed and new medications being developed. There's actually 2 days ago, there was some major change in access to one of the new medications for schizophrenia, which is very positive. So there is absolutely reason to be hopeful. And I think the more we can pay attention to the family members, to the children, to see them, to help them, to listen to them, to arm them with resources, that can help with the hope as well.
That's so good. And I was going to ask you kind of like, what was your big final takeaway? I think you just said it, though.
Well, it's certainly a huge part of it. The thing I just like to mention, because I only have a couple minutes left, is that for the past 20 years, my mom, who is a mental health advocate and teacher, and I have been creating resources for families. And so not only just in my day job, but in my nights and weekends, we've been creating some, and we just actually released 2 in the past couple months. So the one I first mentioned for teenagers is called I'm Not Alone, Teen's Guide to Living with a Parent who has mental illness or experienced trauma. Then there's another one for adults called Loving Someone with a Mental Illness or History of Trauma, Skills, Hope, and Strength for Your Journey. So it's not how do I help my loved one or what are the symptoms of bipolar disorder. And I think you can Google symptoms and treatments and things like that. Rather, what we did is we made our books kind of like workbooks. And so we've taken the research-based skills. How do you work on communication? How do you set limits? How do you navigate the healthcare system? How do you deal with co-parenting issues? And made them all into stories and activities and things like that. So that one was just actually released by Johns Hopkins University Press just last month, actually. So we're kind of excited about it. They're on Amazon or wherever you buy books. But you can look on our website to see sample pages and such, which is seeds with an S, seeds of hopebooks.com. That's seeds of hopebooks.com. I'd love you to check out our website. And again, since large numbers of us experience mental illness and large numbers of kids have parents with mental illness, most of us know at least someone. So if it's not you that's struggling, you may know someone else who is really struggling. And so that is a huge part of my 30-year career of trying to raise awareness of these families and how we can support them in different ways. So I appreciate the opportunity to be able to talk with you, Amber, and help to raise awareness.
Yeah, it's been a great conversation, and I appreciate your time. I know your time's very limited and you have to go, but I do appreciate everything that you're doing, and just educating people is huge. And then I hope that, this episode, people will reach out and just be inspired that there is hope on the other side of that hurt, and that there's resources out there.
Absolutely.
You can find those at seedsofhopebooks.com.
Exactly.
We'll put all that in the show notes as well, so you guys can go check.
And NAMI, definitely a big plug for NAMI, the National Mental Illness, again, free groups, both for the person with the illness, as well as for people who live with mental illness. Not for kids, really. They don't really have a lot for kids whose parent has a mental illness. But a lot of things for parents, of, adults, for partners, spouses, siblings, etc. Lots of wonderful resources available. So you're not alone. You don't have to walk through this alone. And there are people who can help you. Not everyone is trained in this. This is a bit of a specialty area. So find someone who knows what they're doing. This requires special training, special knowledge. Just finding a regular old therapist on Psychology Day or something, they may not know this. So find someone who has specialty expertise and training in this area. And
You have a recommendation for finding a therapist.
Yeah, I think when you talk to NAMI, call your local NAMI and ask them who in our town knows about this. You can certainly look on things like Psychology Today, which you can Google and find a therapist. Lots of people check like every box. Like I do every kind of therapy. So that's not really, you can't really tell on that. Word of mouth, asking your doctor, your care doctor. But people like NAMI, Depression and Bipolar Support Alliance, DSA, they also have free support groups. These people are the ones who are going to know, the people in town who really get it.
Well, thank you so much, Michelle. I know you got to run, but thank you so much for just sharing your expertise with us and for opening our eyes to some things that maybe we didn't know before.
You are welcome. Thank you for the opportunity and blessings on your continued work. And thank you for all that you're doing to raise awareness and empower people and give them hope.
Thank you. Hey there, friend. Thank you from the bottom of my heart for spending this time here with us on Through the Trauma podcast. Your presence means more than you know. If this episode has spoke to you or gave you hope or made you feel just a little bit less alone, then I would love it if you would take a second, subscribe, leave a review, and share it with someone who truly needs to hear it. Every share, every comment, every listen, it all helps our message get out and reach those who truly need it the most. Healing happens inside of a community, and together we are breaking the silence and creating space for transformation. Thank you so much for being a part of this journey. Until next time, be gentle with yourself. You are not alone.